Hey everybody, it's David Sirota. So Howard Schultz is the outgoing CEO of Starbucks, worth about somewhere between $2 and $3 billion. And he's made some headlines recently. There's some speculation that he may end up running for president as a Democrat. He was a supporter of Hillary Clinton's campaign, and he made some of the rounds on TV talking about public issues and fueling speculation that he may run for president. And he specifically made some headlines over at CNBC with some comments about the Democratic Party. He said, first and foremost, he said, I think the greatest threat domestically to the country is the $21 trillion debt hanging over the cloud of America and future generations. The only way we're going to get out of that is we've got to grow the economy, he said, in my view, 4% or greater, and then we have to go after entitlements. Now that last sentence is important, keep it in your mind. Quote, we have to go after entitlements. That's Social Security and Medicare. He also said, quote, it concerns me that so many voices within the Democratic Party are going so far to the left. I say to myself, how are we going to pay for these things in terms of the things like single payer and people espousing the fact that the government is going to give everyone a job? I don't think that's realistic. Now let's break that down for a second. You've got a billionaire CEO who's potentially running for president as a Democrat, saying that he believes the biggest threat to the country can be solved by slashing Social Security and Medicare, the two foundational programs of the Democratic Party, the two foundational programs that are among the most popular programs in American history. And then he goes on to say that stuff like Medicare for all, single payer is way far to the left, and that there's no way to pay for those things. So what's incredible about this is both the economic analysis here and the political analysis. Let's start with the political analysis. Is Medicare for all so far to the left? Well, no. According to polls, universal health care, single payer, Medicare for all poll roughly with majority support. And support has been rising for those ideas. And every other industrialized country in the world has some version of a publicly managed, in many cases publicly funded universal healthcare system. Somehow the wealthiest country in the world, and remember that, the wealthiest country in the world, somehow the wealthiest country in the world can't afford a universal publicly managed, publicly funded healthcare system that exists in far less wealthy countries. By the way, many of those far less wealthy countries getting better health outcomes for their people. So Schultz asks us to believe that we can't, as the wealthiest country on earth, we can't afford the kind of program that other less wealthy countries have and have successfully implemented. He also doesn't talk about the things that we are deciding to spend on. I mean, we are deciding each year to spend, $700 or so billion on the Pentagon. The Congress just passed a nearly $2 trillion tax cut, which most of its benefits flow to the very wealthy. That's the Trump tax cut. We spend at the state and local level billions and billions of dollars each year on economic subsidies to corporations. We are a country that spends a huge amount on those corporate subsidies and the like. So the point here is, Schultz asks you to believe in his statements that it's a far left proposal and unaffordable to propose investing in healthcare in the way that other industrialized countries invest in, but not discussed are all of the other expenditures that we're making that could potentially help, if the money was diverted, could potentially help offset the cost of those investments. And instead he's saying the big thing he wants to go after, the big thing we supposedly need to go after, are entitlements, to actually cut Medicare and Social Security. Now the question will be, politically, whether this kind of message resonates with Democratic voters, with the Democratic political class in Washington, D.C. There's no evidence that that argument has much traction among core Democratic voters. When you look at polling, when you look at the results of elections, you've got many Democrats now campaigning for Medicare for all. There's not a lot of evidence that what Schultz is saying will have resonance among actual voters. The other question, though, will it have resonance among the Democratic political establishment and the political class in Washington? Well, that's a tougher question. Schultz is a CEO, a former CEO, worth $2 to $3 billion. It's the kind of person who can wield a lot of power when it comes to economic resources for elections. What will be the reaction if Howard Schultz ends up running for president when he starts campaigning for president as a Democrat, saying that we should reduce or roll back parts of Social Security and Medicare? What will be the reaction of the Democratic political class when Howard Schultz, if he runs for president, starts saying that people who are proposing Medicare for all are too far left and fringe? Watch for that reaction, because that reaction will tell you whether that Democratic political establishment, whether there's a gap between the grassroots base of the Democratic Party and that political class that runs the apparatus of the Democratic Party in Washington. I'm David Sirota. You're watching TYT Investigates. You can find all of our work at TYT Investigates on Facebook and on Twitter.